Okay, thank you, Anders. Thank you, Ulf. Thank you, Ebba, for giving me this opportunity to talk about the project that Ebba was briefly introducing. Here, I will expand for about, I don't know, 15 minutes or so. So my name is Peter Bergsten. I work at, as you see, Uppsala University and also at the region in Uppsala with childhood obesity, different aspects. And my presentation, let's see, here it goes. I will look into it from three angles. The current situation, which will lead up to why we need to prevent childhood obesity, and also how we can succeed with it. So this is the current situation from the European perspective. Now, childhood obesity is a global problem, but let's focus for now, for this session, on the European situation. This is from a worldwide study which was published a couple of years ago by the Risk Consortium. It included children 5 to 19 years of age, and look at the span during which data was accumulated. So 45 years, and you can see these different parts of Europe. They divided it into different, and I guess we're maybe the northwestern part, but the red rim, the most top part of each square, indicates a BMI of more than 2 standard deviations, indicating obesity. So as you can see, although we start at different levels in the different parts of Europe, we all end up around 10-fold more compared to what was the case in 1975. Okay. Yes. Okay. Let's now zoom in a little bit. Now we're in Sweden, and I was looking at a recent survey where 4-year-olds were collected, with regard to their body weight or and height, for that matter, i.e. to what extent they were overweight or even had obesity. And this is divided into regions, and the yellow bar indicates the average. And as you can see, so among 4 years old, and this is recent data, 2018, so very up to date. So 4 years olds are around 12% are overweight, and as you can see, 2% of those are, it's jumping here a little bit, have obesity already. Now we'll zoom in, and I've chosen the region of Jönköping, because there is a recent study from Jönköping where they have detailed even further. And this is to illustrate that in a preschool class in the region of Jönköping, among the 10 or so boys, 1 will be overweight, and so also among girls. And just for a second, this is the case throughout Sweden. This is the case throughout Sweden. If we look at high schoolers, 16 years old, this is the situation. Now in Jönköping, but Jönköping was a little bit above average. So this is representative of pretty much the situation in Sweden. About every 5th teenager has overweight or even obesity. Again, just ponder this. This is the situation throughout Sweden today. And Folkhälsomyndigheten has just recently made calculations also throughout the lifespan. And as you can see, as we in Sweden get older, a bigger and bigger percentage of the population being overweight or even obese is at hand. So this is the situation. Why should we do anything about this? Well, before I go into a couple of examples, I'll just show you this graph. This was, you can do science of everything. You can do science of what is being published. And here is such a study, which is pretty interesting. It records all articles, all works, studies that have been conducted addressing childhood obesity. And this is how many such publications are there per year. And they started back in 1945, where there were one or few, and then all the way to 2014. And if it just, this is if you divide it into different age groups, but just look at the top one where everything has been summed up. So in 2014, well over 3,000 publications were published in that year. So even more now, 4 or 5 years later. So this is accruing knowledge, what childhood obesity does. And here, just an example, and as Ebba already told us, this has consequences both for physical and mental health. And I'll give you an example. This image is an abdominal scan with a so-called magnetic resonance camera, and white depicts fat and black depicts tissues that contain mostly water. So here is a 13-year-old boy with a rather thin subcutaneous fat area. So he is normal weight, whereas these two boys, they have a quite substantial subcutaneous fat, i.e. they have obesity. And we chose them to have the same, if you calculate the age-adjusted BMI, they both have 30. But, and look here, the abdominal scan is done through the liver, which is depicted here. And this liver has a clear gray appearance, whereas in the normal weight child, it's black. This 13-year-old boy has 12% liver fat. The cutoff between fatty liver disease is 5. So we can see, and this is actually projections, that the obesity epidemic will cause lots of liver disease, in addition to what we've mentioned about type 2 diabetes and other things. And even so importantly, mental unhealth. This has many consequences, and I think Ebba elaborately talked about the healthcare cost and so forth, so I will not go into it, but just stress it once more. This is just not sustainable, what we're doing. So how can we prevent this? Well, essentially, it's about helping the child and its families to make healthy choices, taking into account that both heritage, the biology, the genes, and so forth, and the environment around the child affects such choices and behaviors, and to what extent you develop childhood obesity. Long-term commitment from multiple actors in society was nailed down as a key success factor in a rather recent report from the WHO, and also in a review article where Sarah Bleish at Harvard went through different interventions from the point of view to what extent they had many settings, i.e. healthcare, home, school, etc., and components addressing maybe physical activity or diet, etc. Usually an intervention will be monocomponent, for instance, diet, in a setting at home. And she concluded that if effectiveness were to be obtained, you need multi-setting and multi-component approaches. And maybe, just there, look, today, and this is our dire situation. Today, there are no solutions available that can produce effective prevention, sustainable and scalable. And thus, the initiative that Ebba was talking about, SweLife, took on the strategic project Prevention Barnfetma, or if you want, you can translate it, with a vision, zero obesity at school start, i.e. at 6 years of age, we should cut obesity from around 4% to 0 to naught in 10 years. This is a vision, but it's also, it's more than a vision. It is something we need to do for reasons that you have just seen. And yes, and also an underlying question is obviously, how can you transform our healthcare system into becoming more preventive? Vinnova is behind this, and the homepage where more information is available is down at the bottom. So to just briefly allude, this is also on the homepage, but the project is divided into 4 parts. One part looking at what works and what evidence is there for what is effective. And more importantly, in order to see effectiveness, we need to have good data. Good data, what should we measure, and also accessing already available data. And then, as pointed out, we need always to work with incentives and how society can be stimulated to become financially sustainable. And last and of most importance today is the grand challenge that we are all waiting to start. So just an update. We've been working now for about half a year, and I'm just abbreviating it, the Swedish Childhood Obesity Prevention Initiative. That's SCOPI. I don't know if this can be official, but anyway, so SCOPI today, with regard to the intervention, it is working with the national guidelines for physical activity, food and sleep, engaging the children, the families, public, private sectors, and more, i.e. a whole of a society approach. Implementation at the municipality level, i.e. leading to a necessity for transforming a system, the societal, all the intricacies in a society. How do we follow? Well, this is the important part. We need, and we are in the process of deciding what indicators, what data are to be accumulated during the project, and also retrospectively, what should we look for to be able to integrate health and societal data. This is extremely important to determine effect, and scalability is what we're doing worth scaling. And then, as said, all these extremely important components to change society is also addressed. And finally, novel interventions, novel ways. And this is all you who listen to this, then we call upon your creativity and imagination to help us combat childhood obesity. And just to remind you of Sarah Blythe's conclusion, we cannot expect an easy solution to this very complex problem. And another colleague in this field is Bruce Lee, who's tried to depict how one can see it. So all different levels in society, biology and the individual child, its near context, society, and also the greater at the national level, they all interplay to form solutions. So with that, I would like to thank you all for listening, and I'll be happy to take questions.